Hello, my name is Dr. Neil Baum. I'm a urologist in New Orleans, Louisiana, and I would like to take the next few moments to speak with you about the condition referred to as pelvic organ prolapse. In this 5 to 7 minute video, I'm going to discuss with you the causes of prolapse, the evaluation of prolapse, and what treatment is available for this common condition. The problem of urinary incontinence impacts and affects nearly 14 million American women. The most common condition that is referred to as pelvic organ prolapse is often called a dropped bladder. But pelvic organ prolapse can refer to prolapse of any organ within the pelvis, such as the uterus, the intestines, or the rectum. Pelvic organ prolapse has a range of severity from very mild to where it can only be appreciated by the physician at the time of your examination, to very severe prolapse where you can actually see and feel the organ protruding through the vagina. So let's begin with the causes of pelvic organ prolapse. It is due to a weakening of the muscles in the pelvis that results in a fall or a protrusion of the organs such as the bladder, the uterus, intestines, or the rectum. The common causes of pelvic organ prolapse include childbirth, where there is stretching of the muscles in the pelvis at the time of a vaginal delivery, and with each successive child there is additional stretching resulting in the prolapse. Aging process itself is associated with prolapse. As women go through menopause, they have estrogen or hormone deficiency that often weakens the muscles and the tissues in the pelvis. Heavy lifting over a long period of time can weaken the pelvic support mechanism, resulting in prolapse. Also, excessive weight gain, especially quick weight gain over a short period of time, or chronic coughing can also be associated with pelvic organ prolapse. Now, what are the symptoms of pelvic organ prolapse? The woman will often experience a fullness or pressure within the vagina. She can often feel or palpate the organ that is coming through the opening of the vagina, or can see it if she uses a mirror between her legs to examine herself, and the prolapse can easily be visualized. In severe or difficult cases, there can be a problem of defecation, and the women will often have to strain in order to move their bowels. Rarely does the problem of prolapse associated with kidney obstruction that can result in renal failure, but this is often corrected when the prolapse has been repaired. Let's now look at the evaluation of pelvic organ prolapse. It requires a history, a careful physical examination, particularly a pelvic examination, a urinalysis, and then a few tests such as a cystoscopy, which is a look into the bladder with a lighted tube, and a test involving the bladder to check the pressure within the bladder and measure the pressures within the urethra, which is the tube from the bladder where urine goes from the bladder to exit the body. Finally, I'd like to talk about the treatment of pelvic organ prolapse. There are essentially two treatment options. One is the use of a pessary, and the other is surgical repair of the prolapse. A pessary is a round donut-like structure that is inserted into the vagina by the doctor, and it is worn permanently by the patient. The patient has to come back periodically to have the pessary changed, cleaned and changed, and reinserted. It can be associated with infections in the vagina or within the urinary tract, but this is not very common. The pessary is left in place for several months between changes at the doctor's office or by the nurse. It is not effective in all patients. The woman has to have an adequate vagina in order to be able to insert the pessary. The other option is surgical repair of the prolapse. This is usually done through the vagina or occasionally done through the lower abdomen. Most patients can have the procedure on a one-day stay basis, meaning they come to the hospital or the ambulatory treatment center in the morning, have the procedure, and usually leave a few hours later. Most women can have a repair and then return to almost normal activities within a day or two after the procedure. However, they are not able to engage in sexual intimacy, have a douche, or engage in any heavy lifting activities for a period of 4 to 6 weeks after the procedure. Most cases of pelvic organ prolapse repair are very successful, and most women report that they have marked improvement in their lives and improvement in their problem of urinary incontinence after the procedure. So do your homework. Check on the problem of pelvic organ prolapse. Find a physician, either a urologist or gynecologist, who can do the procedure or fit you with a pessary. The bottom line is that most patients who have the problem of pelvic organ prolapse can be helped. And in this day and age, no one, and I literally mean no one, has to depend on Depends. I know you may have some additional questions regarding pelvic organ prolapse, and I'd like to refer you to my website at www.neilbaum.com, where you can find some additional information on this condition. You are also welcome to contact me at my office at 504-891-8454. I look forward to hearing from you. Thank you.